So knowing that a large portion of the blood clots actually don't pose any signs or symptoms, what are some of the lifestyle changes that patients can make in order to prevent those from happening?
Well, you're talking about something called incidental thrombosis, and it's usually when people do a scan, a CT scan, to assess the stage of the tumour, and they may find on that scan there are blood clots or pulmonary emboli. It's still important that we treat those, even though people didn't have symptoms,
Of course.
because they are still as important. What can patients do to minimise their risk of blood clots? Well, I think there's some general healthy lifestyle things to consider. Remain hydrated, because if you have dehydrated blood, it becomes more sludgy. So just drinking fluids. When you're having chemotherapy, try and drink plenty of fluids just to keep the blood flowing. I think the other thing is immobility, stasis of the blood in the legs. If you don't move around, the blood just sits there, increases the risk of clots. So try and get people to get up and mobilise. I'm not saying go out for a 10-mile run or a walk. I'm just saying,
Just
if you can,
stretch
your legs, move your feet around like that. Just the fact that we've been sitting in this chair for 40 minutes,
long enough.
The flow in our legs has gone down. We'll have to stand up and stretch in a minute.
Absolutely. Let's do that.